Yeah, I got it off. Happy New Year, Dr. Rob Kiltz. How's everyone doing? It is a beautiful, beautiful evening. And refresh your page, and I'm getting there. And I'm here to answer your questions and share some ideas of how to improve your fertility journey, which is extremely, extremely difficult and challenging. And we're doing an IVF giveaway, and it's going to be next week privately shared and then published, publicly acknowledged. And we really want to see comments, and please share your thoughts, ideas, and likes. And the more we share together, and the fertility and Facebook fertility CNY support is really, really, really amazing and so, so helpful to everyone. And just as we send in the questions, I'm going to be answering them, sharing some ideas on how to improve your fertility naturally. And whether you're unable to conceive, or you've had repetitive miscarriages, or you have other issues related to fertility, we're hoping to be able to kind of give you some insight in how to improve the journey. And I gotta just get to my questions section here, Mr. Will. If you'd help me with that a little bit, that would be really good. So give me 1 second.
It's pretty much everybody just saying hello right now.
Yeah.
So I already asked for some questions.
Yeah, we're getting there. But I want to see half screen. You remember how to do the half screen?
Do you want to use that?
Yeah, that's what I need. I need to see that. Give me 1 second. It's our usual few minutes of technical support in order to get there. Got it. We just have to change the direction of the iPad, and it'll work nicely. So thanks everyone for just being patient for 1 second, and we'll get there. And we have plenty of time. And as always, I'm really, really grateful to all the wonderful and amazing support that everyone is giving us out there. And be patient with the process. That's one of the most important things that I've learned, because this is one of the most stressful things that you and I can do in life, is undergoing something that's supposed to happen naturally, and it's not. And shout out to everyone that's saying hi, and your questions, always amazing. And it's been really interesting. We've been on this journey for over 20 years at CNY Fertility, and seeing patients from around the world. And so much of it is learning how to integrate Eastern and Western medicine, which is something as a Western trained doctor I didn't believe in or understand at all. But I've really seen how much the Facebook support just makes people feel better, because remember, this is a village, and we're really herd animals that are meant to come together and share in small villages. And when women talk and get the support, they feel better. Cortisol and epinephrine levels go way down. And then serotonin and oxytocin levels go way up. So, this is one of the reasons why I recommend yoga for fertility. And Erin in our Rochester and Buffalo office has done a really amazing job. And so many women are coming to those. And guys, you're invited also. And we likely should really begin to think about bringing together a support group for guys, because that's really one area that we've missed in all of this. So let me start up a little bit here, and first, Denise, thank you. It is a very, 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 very frustrating process that all of us are going through. And, it's the burden and the emotions that push us and make us depressed and sad and so much want to give up. And, it's the one thing I've really encouraged is positive approach and listening to really positive people and reading positive books and doing a spiritual practice every single day. And whether you believe in a religious God or just a higher power, that's where that daily approach comes in. Journaling, write your feelings down, and when you write them down and you talk about how it really affects you and your partner, your family and your friends and your work and your whole life, because this is one of those very basic instinctual needs that we all have in order to build that family. So again, let's keep on sharing in all of this. And there's so many shout outs, and I'm working to get to a few of the questions here. But one of the things that we've really talked about is how we've gone from so many fresh transfers to so many frozen transfers. And we used to think that fresh was best, but we're finding more and more that freezing embryos and syncing up the uterine environment to better accept that embryo or embryos is so important. And we've been recommending both day 3 cleavage stage embryos and blastocyst embryos, which are either day 5, 6, and sometimes day 7. And it really seems to be a better step. If the hormone levels are lower, progesterone is less than 1.5 on the day of trigger, then doing a fresh transfer still may be reasonable. And for those that have more embryos, and I know so many people are traveling from long distances, and we really are working to get that fresh transfer. And so I think it's still reasonable to consider it. But when it's not working fresh, consider frozen. And the other part that I've been talking about is whether to do a day 3 cleavage or blast, freeze all, or transfer. And there's not one way to skin this. There's so many different ways, and we work to individualize it. So for those who have had poor blast production or have fewer embryos, doing a day 3 is better. For those that have multiple, more than 5 embryos, then going to blast is more reasonable. Now, if you're doing embryo biopsy and testing, then blastocyst is a need. You have to go there, right, in order to biopsy the embryos. And I've got some opinions about that, and we'll talk about that as we go a little bit longer in this. And Tara, thank you very much for your question. What do we recommend for repeat miscarriages? Blood work and testing done, and the panel, RPL panel. But what else do I recommend? Well, one of the difficult challenges is to understand why does an embryo begin to implant and then stop, and whether it happens before you even really know it, or it's happening in a very early stage. It's just a blood test, a biochemical, or we're visualizing a heartbeat, or it's even later. Inflammation is the #1 cause. And so that inflammation in the endometrial environment, in the uterine environment, in the pelvic environment, is likely the #1 problem. And I've really been focusing on ketogenic diet and paleogenic diets. I say if the paleo is not working, you have to go keto, and look at Marie Emmerich's stuff on ketogenic diet. And we're really working together to help everyone out there share some changes in the food they eat. But medications to help reduce inflammation in the body, such as prednisone, Lovenox, low-dose naltrexone, baby aspirin, and we've even been working with things like Plaquenil and Humira, and these may or may not be right for you. But I'm giving more of a generalized approach. So it may be that you're getting pregnant naturally, but we want to add some of these things, including intralipids, which is a fat infusion, and that's why the ketogenic diet really is important, because by adding more fat to your diet, and if you read Dave Osprey's book on Bulletproof Coffee, his wife, after eating butter, had a successful pregnancy. So we're seeing it more and more, but IVIG and LIT therapy or some other approaches. And I'm going to give more of a generalization here, and you can read more about it and Google it, and we can talk more about it on an individual basis. But in fact, whatever we can do to reduce stress in our bodies, first in the mind, then in the mouth. What comes out, what goes in. What affects the intra-abdominal space, which is where the reproductive organs are, and the excessive inflammatory condition that causes fermentation, gas, heat, aldehyde, alcohol in the gut, an excessively high carbohydrate diet, which causes something called glycation, excess glucose in the body, which is affecting every cell of our body. So by doing some of these treatments, you're making some changes in the environment. I call it the human Ferrari, and we're all that. It will really be helpful. I've also suggested laparoscopy to look for pelvic endometriosis and pelvic inflammation. Fibroids and adhesions can also be removed, which are factors in all of this. And then a hysteroscopy DNC. And think about a prolonged course of oral antibiotics, which may be suppressing chronic endometritis, which certainly will adversely affect an embryo attempting to implant. But remember, abnormal sperm, abnormal eggs, abnormal embryos, which have difficulty implanting, and that environmental factor within our bodies. And then PGS, or pre-implantation genetic screening, may be valuable if you have more embryos to try to selectively look for those embryos that are normal and increasing the implantation potential. And then the other part to this is karyotyping. Look at the chromosomes to look for translocations, which may also be a cause of that. And Brianna, we look forward to the talking. Hi, Tiffany, really wonderful, and thank you for everyone joining in and sharing. And remember, people are asking these questions all over, and everyone's sharing them. I think that's what we're realizing. We're all learning together. And Dr. Google is smarter than people think, by the way. Kathy, or Katie, told IVF is our best option after trying IUI multiple times. How long is the wait between the first day of the cycle, injections, and doing IVF? Well, typically at CMI Fertility, we rarely use the birth control pill, so we're rarely trying to push people out. So you typically call the first or second day of your menstrual cycle. You get an ultrasound and blood testing either the second or third day. And typically you're going to start the gonadotropin shots on the second, third, or fourth day of your cycle. You're going to be taking these shots for an average about 10 days, with ultrasound and blood tests approximately day 6, 8, and day 10, and usually taking the trigger shot, which is a combination of either Lupron, HCG, or Ovidrel, or taking just Lupron as a double dose, or just HCG or Ovidrel to release the eggs. And then 36 hours approximately, an egg retrieval is done either in our Syracuse or in our Albany facilities. And great docs in Albany, all our docs and practitioners and nurses are really wonderful, and we're really grateful for everyone always sharing support and ideas and how we all can improve. The injections are really very simple, but you can do natural cycles, you can do letrozole or mini cycles, and that's all going to depend on individual factors in which protocol is defined. Our most standard is gonadotropins, about 300 units a day, 10 days of shots, trigger shot, 2 days later retrieval. And if it's a fresh transfer, it's going to be between 4 and 7 days after the retrieval. And if it's going to be a freeze-all cycle, you usually come back about 6 to 8 weeks later for an embryo transfer. So I hope that was helpful. And Colin and Jennifer, thank you very much. We are all changing lives together, by the way, and that's the one thing I've really learned. And someone called us hope dealers and merchants of hope. And in all ways, I think we're all working together to help make this happen. And as we see more and more people coming together and helping with ideas and maybe donating eggs and sperm and embryos or helping with other resources that'll help more and more people find the fertility journey more affordable and more successful. All right, Carrie Jo, thank you very much. Keto for 30 days, doing my very first egg retrieval at the beginning of February. Doing keto for only 60-ish days will still improve my chances of successful IVF. Well, I believe any amount of time of doing keto has just been the most amazing thing. And again, I learned all of this because of some patients who were getting pregnant and whatever we were doing wasn't working. And most of them were doing the paleo diet. And as I read and read and read and learned, Gary Taubes, Anders Sienfeld and Maria Emmerich and Jimmy Moore and Jason Fung, so many people have helped me understand this, but now I really understand the effect of our standard American diet, and keto is king, whether it's 2 weeks or 30 or 60 days, any of that will help. One of the most important things that I've been finding is that stay keto throughout your pregnancy. It's the most amazing thing I've ever seen. It'll reduce miscarriages and help you get to a term pregnancy so much better. Amanda, how you doing? And we'll dye test tomorrow. Good luck. Even doing the hysterosalpingogram dye test, by the way. Catheter in the cervix flushes out the fallopian tubes, and it may actually reduce inflammation. And so many women are conceiving just after doing that test. We have been recommending the oil contrast. We think that it works a little bit better, but it's a little more expensive and a little harder to get. So it's just something I think is really, really, really helpful. Hey, Christy and Bran and Michelle and Heather, thank you. Lauren, we really appreciate everything you're bringing. Let's see here. Okay, and listen, the IVF giveaway is for anyone who wins it, wants to share it. That's the key. And we're going to be doing these every single month, by the way. Megan, trying to conceive for 10 years, unexplained. Idiopathic is another word for that. And I've always said we doctors are kind of idiots in this. But I call unexplained inflammatory inflammation as the main cause. 5 losses. It's really amazing. I've been talking to so many women who have had loss after loss after loss, even after having a normal conception and delivery. 3 failed transfers, nothing more than a take-home baby. Let's see, there's more there. Persistence, that's a hard one. And, when you're just brought down after a failure, it's hard to dust yourself off and keep on going. But that's where the conversation, cry, let it out, beat the pillow, and then come back to some support. Share the story with a friend, a family member, a stranger. And for some, it may be important to talk to a professional therapist. I think it's really important not to be afraid to do that. I've gone to therapy. I go to therapy. I talk to the therapist all the time. I find it very supportive. It's a great coach in all of this. Let's see, Jacqueline. Hi, Jacqueline. How you doing? Recommend people to see maternal fetal doctor. I think any doctors that have expertise in reproductive medicine and women's health can be helpful. I believe in holistic approach, and whether you're doing acupuncture, chiropractic, massage, yoga, and looking at oil therapy or sound therapy or light therapy, all these things can be very, very helpful. I think sometimes we're looking for problems and we're not sharing solutions. And the interesting part to this is I've rarely found that we find the aha moment, since so many couples suffer from unexplained infertility. And I think that unexplained really comes down to inflammation, and our ability to diagnose it isn't very good, but I would say that is most likely the number one issue. So I hope that was helpful for you. Laura, thanks very much. I came for my first FET, everything, endoscratch, HCG wash, embryo glue, Neupogen lipids, and still failing to implant. Tubes removed, and MTHFR, insulin, we'll keep going. Resistance, insulin resistance, MTHFR, and hydrosalping seem to be the only issues. Well, remember, let's not forget about the sperm. It's a big issue in all this, and the guys have to be sharing in keto, slow it down, yoga, acupuncture, massage, and Conception XR, inositol, ovasitol, I believe are really helpful for all of us because it brings down glucose and insulin. And don't forget low-dose naltrexone. And if you Google LDN and look at the LDN book, low-dose naltrexone is an opiate agonist, antagonist, and it seems to reduce inflammation. And Phil Boyle in Ireland's been using it for years. I find it very, 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 very helpful. So it's something to look at in this whole process. All right, Bree, thank you very much. 7th time transferring, a lot of stuff. Immune protocol, keto, anything else that we recommend. You know, if you haven't done a laparoscopy, hysteroscopy to look for endo, highly recommended. The scratch procedure, you may have done that already with HCG wash. LIT or leukocyte immunotransfusion, where going to Toronto to visit with Markham Fertility, and that's Mike Vero. They've been very helpful. We've seen so many of our couples finally conceive after something that I can tell you I thought was crazy. But one of our clients went to Nogales, Mexico. It's the other place to get the LIT. And the aborted guard asked where they were going. And when he found out, he said, my wife went and had LIT, leukocyte immunotransfusion, husband's white blood cells injected under the woman's skin. It's an allergy shot. And conceived and had a baby. So it's really interesting. But IVIG, LIT, Humira, and Plaquenil are those other ideas. And sometimes we need to look towards a gestational carrier or a surrogate in order to help make that next step. But you know, it's donor eggs, donor sperm, donor embryos, gestational carrier, and adoption are all things that really need to be considered and put them on the menu. But keep the picture of the baby and the family in front of you. And remember, faith, persistence, and despite all the negative and the hurt and the challenges, work that positive attitude. Keep it going every single day. I start by reading a positive quote, spiritual, inspiring every single morning with meditation, a little bit of yoga, Tai Chi, but slow it down. That's the most important thing. And Ara, how you doing? First cycle failed. 13 embryos didn't make it to blast. And you know, that's one of the biggest challenges. We're seeing so many where the day 3 embryos look great, but they're not blasting. And we think that may be a sperm issue. Embarking on our second IVF cycle, day 3, freeze-all or fresh transfer would be helpful in that. I really believe that there's still some centers that are doing day 3s and getting good results, and some people believe only day 5 or blast, but I think we have to individualize, look at the past history, and look at the current. I talked to one patient today, high number of embryos, had over 10 embryos, and only 1 blasted. My recommendation would be to consider transferring that embryo as a frozen embryo transfer, and then coming back if it isn't successful and freezing at the day 3 or cleavage stage in this. And often we may be also adding human growth hormone, making sure full keto, LDN, and in some cases where the ovarian reserve is lower, that's where you add DHEA. Again, keto is king, low-dose naltrexone, and think about, we've been doing the 30-day prime, but now we're pushing it out to 60 and 90 days. And these are really, they're not exact. You know, it depends on your age and how quickly you want to move forward. But it also may be that serial cycles, first cycle you get 5 eggs, the second 10, the third you get 20. We've seen that time and time again, and it may be the more you do this, the more you're improving the blood flow through the system. And that improved blood flow helps kind of clean out the system and reduce inflammation, I think, in so many ways. But I think that's, we're also seeing so many couples, individuals who have failed a cycle, but then get pregnant the next cycle. So remember, always make sure that your relationships, you're focusing on those primary things and don't lose that. Thoughts on, Lila, how you doing? Thoughts on acupuncture for low AMH and high FSH. So Heather, one of our acupuncturists in Rochester, who was one of the first that brought acupuncture and TCM and herbal medicine to my attention, and I've learned so much from her. And she'll be going to the Vancouver seminar this April with some of our other team members to learn more about how acupuncture and Eastern medicine can help. And we don't know how acupuncture works. I think there's the connection between the acupuncturist and the patient. That healing really begins. It's a belief, it's a placebo. But remember, placebos have real physiologic effects. But exactly how those needles work, we don't really know. But I believe there's evidence that it reduces cortisol, epinephrine levels. It makes us more calm. And I've had acupuncture where, wow, it just chills me out and makes me feel wonderful. So I think it's really important to look at those therapies along with yoga, support group, massage, and meditation. So don't forget those sort of things. And Melinda, how are you guys doing? And shout out for everyone. Denka, a pleasure. And we're so grateful. Thanks for watching to everyone. Natalie, how you doing? And I can go down the list. Lauren, Ricky, and Denise, and just again, such a family we've all developed, and I'm learning every single day. And all right, Ricky, what do you recommend for someone 43, 2 miscarriages, 11 weeks and 6 weeks, and 2 failed transfers? Well, I went to a seminar with Dr. Gleicher this in October, November, and really helpful. And I've learned a lot over persistence, and changing it up really matters. We don't know if it's just the right embryo, right egg, the right sperm, the right embryo before that implantation happens. But I also recommend lower doses, mini dose, even some natural cycles can be helpful. The DHEA, the LDN, don't forget the acupuncture and the support group, really helpful. And then a combination of either Clomid or Letrozole with low-dose injectables of 150 and trigger early at 16 millimeters rather than letting it go later may be helpful in the process. And then a freeze-all cycle can be helpful in that also. And it may be, in that case, do either natural or Letrozole with the trigger shot to time the embryo transfer. And then the immune protocol, interlipids and Lovenox and prednisone, all can be helpful. Sometimes it's like we're throwing everything at it. Sometimes it's a matter of actually backing up and doing less and keeping it more natural. But if what you're doing isn't working, we have to always be thinking about changing it up in this whole process. Denise, how you doing? 5 losses. Very frustrated, I know that. IVF cycle would be helpful, and I know that, and we're all praying for everyone here. Maya, a pleasure, how you doing? We've changed some pricing and all of this, and we're thinking about some other things and how to help support keeping the payment plans, $3,900 IVF. We've added the $250 for frozen embryo transfers because the actual cost of that transfer and the freeze-all cycles have really added a lot, but I'm really working to keep the prices as low as possible, and we've been doing this for 20 years. So whatever we can do in helping out everyone in this process. And in New York State, Como just is studying, but it looks like we're making some progress in IVF coverage, but the real key here is affordability, because so many people do not have coverage, and whatever we can do to help with that. And yes, Aaron is the best, Amy. Thank you very much. And yoga classes. We've seen so many women coming from so many other fertility centers and learning some new things that they could bring back to their own physicians and practitioners. And sometimes by just coming to CNY Healing Arts and doing yoga for fertility, that's the change all. And we're really here to sort of work with everyone out there. And this isn't proprietary. We're not trying to hide anything. We're no better than anyone else, because I think we're really working to do this together. All right, besides the RPL blood panel, what would I recommend for the next frozen embryo transfer with 3 miscarriages? Well, the testing is less valuable, but the treatment options are the most important part to this. Keto, LDN, the Ovasitol, the Ovavite, which has the methylfolate for MTHFR, it has the extra vitamin D, it has the CoQ10, and so it's really, really helpful in all this. And then think about Plaquenil if you haven't used it. And much of what we're doing here is really looking at how most autoimmune diseases are treated. And interesting enough, there's really no test that usually tells people which treatment. It's more of a global treatment option. And so if it's a clinical diagnosis, if one thing isn't working, we need to shift it up. And so endometrial scratch, hysteroscopy, laparoscopy for endo. And this is where the HCG wash, the sub-Q Neupogen, the weekly intralipids, the every 2 to 4 weeks of IVIG comes in. And I think just the weekly support is really, really helpful in all of this. And, you know, I'm getting so many text messages and so many calls, and I apologize if I'm not always getting to everyone fast enough, but remember, there's always the correspondence, and our nursing team is amazing, and we're really all working together to get it out there. And I know if there's an issue, people share it around, and we're all working to get there together. So we so appreciate everything. Thanks, Megan. Casey, really a pleasure. Donna, how's the daughter? How's the sons? How the kids? How's the family? But, you know, again, when it's not happening and it's so lonely, that's our job to connect with these people and inspire them with our stories. And so, you know, if you had a story of loss and failure and then success, how did you get there? How many people found that paleo or keto diet seemed to be the thing? You know, I've always said give it up. And so by giving it up, it's sort of giving our faith up to a higher power that helps us be calm and keep going in the process. And Amanda, omnitrope and tevtropin for priming. Well, the omnitrope, the tevtropin I don't think comes in the right method of a vial to use at this point. So it's really, there's only a few that we have available, and our nursing team can help with that more than anything. But we've been using the human growth hormone, 6 units a day, seems to be really helpful for in stem, a couple of weeks or a couple of months, we're really adding to that. But I think that that may be one that we need to directly communicate with. But omnitrope is the one that we've been using the most in this. And always praying and having faith to all of this. You know, we've been talking about embryo glue lately. And embryo glue is a culture media that the embryos are incubated in for about a half an hour prior to transfer. It's an added step that actually adds a little more complication in motion and transferring of your embryos, which we think isn't the best, but we've been using it in some cases. We actually did a trial a couple of years ago and found no benefit. And so I'm not really pushing it, but it's something people are asking for, and it's a little bit of a challenge because there's so many details getting to the embryologist, and that last step is something that takes a little bit more work, and I am not in love with embryo glue, by the way, and so I'm not generally recommending it. But some people are asking for it, and we're going to do our best to accommodate that, by the way. And you know, it's interesting, Matt. Thank you very much. The people are flying and driving for 5 or more hours, and we're so appreciative that you know, our mission is really to change it up, integrate Eastern and Western, bring all these ideas from everyone that's had success. What did you do? What is the change up that you had that you can share with all of us that will help make it happen and possible? Thanks, Melissa, Christina, appreciate, Roberto, again. We are here. You know, we've seen patients from, again, all over the world in this, and when it's not happening any place in the world, because we are all human beings seeking relationship, love, connection, family, and it is very difficult for any and all of us. So keep it going. Shauna, Kelly, all amazing. You know, the support groups, just being there is helpful, by the way. And also, even just being in the group, even though you may not be commenting or sharing in, you're listening. And the brain, when it listens to the ideas, begins to build all the necessary particles and energy to bring that which you desire to your life. So I've been reading a lot of Jack Canfield, Eckhart Tolle, Deepak Chopra. You know, the list goes on and on and on of the inspiring people out there that help us, that help keep us moving forward. And if you weren't depressed and emotionally down, you know, you wouldn't have sort of the energy, I call it energy of motion, to push us to get off the couch and seek some advice from, again, friends, family, strangers. But you know what? We're not strangers here, okay? We're all together doing this. Frank, thanks, and Heidi, how long of a wait is there to get to see you? We have decided to go with your facility, traveling from Michigan. And, you know, not only myself, but Dr. Corley, Dr. Arroyo, Dr. Ditkoff, Dr. Grossman, my nurse practitioners, Kelly, Meg, Grace, and I'm not mentioning everyone, and I apologize, but all of us together are working hard. And, you know, I focus 24/7 on making sure the things we're talking about are carried out by our entire team. And so that's, I think, really important. But, you know, I would say weeks or a month to get in to have a conversation. We do a tremendous number of either FaceTime, Skype, WhatsApp. I talked to a patient from Sierra Leone today, and again, from all over the world, but simply email, text, and we can begin the conversation. And Will, my nephew, has been tremendous help in the process. He's getting into medical school this next year, and hoping to bring him on the journey to help all of us in improving the journey. Kyla, thank you very much, and blessed for all of us. And you know, I'm just a regular person like each and every one of you out there, and I've just been practicing this for a long time, and I've learned how much I do not know. And when I began to turn my brain around and begin to listen and learn some of the things I didn't believe in, I was fascinated to understand how important inflammation and stress and diet is in your health. And remember, we are Ferraris, right? We're the most valuable, irreplaceable, the most special. And we need to begin to treat our bodies like a Ferrari, right? And you need to be really conscious of what you put in the food basket, what you take home, what you put in here. And then the same goes with what you put in here. Turn the news off and all the gossipy stuff. It's like not worth it. What you want to do is you're on a journey to learn something new and interesting and exciting, that in this process, if what you're doing isn't working, that means there's something completely opposite that may get you where you're going. And I've always said the Ferrari mechanic might know more than you and I in this process. And I like to say that I'm a Ferrari mechanic and you're a Ferrari, and we're going to help you get there on this journey. And sometimes, you know, I had a couple come to me one day and said, Dr. Kiltz, I'm so glad it didn't work with you. And I was like hurt and shocked. And they showed me a picture of the beautiful baby that they adopted. And so we need to be open to all possibilities. But remember, when you give it up, there's a higher power there for all of us. All right. Sarah, how you guys doing? Low AMH, 0.13, endometriosis. Taking human growth hormone, low-dose naltrexone, DHEA, CoQ10, vitamin D, iron, and estrogen. Starting keto, cool, awesome. And you know, sometimes it's worth starting with paleo if keto is too difficult, but I think it's really important. And look at Maria Emmerich's stuff. And Maria and I are working on a book, going to share more about the fertile keto cure and journey. Is there anything else I can do to help keep the endometriosis at bay? Lap in September, 2 months of Lupron, good. You know, I've been looking at letrozole 2.5 milligrams a day for 30 days or more, and stop the estrogen, by the way. And we used to use the estrogen a lot more in order to sort of bring up the AMH and decrease the FSH, but I think we're realizing that that might not be such a good idea. And so cutting that out would probably be good. Think about the letrozole. And I think, you know, those are really the most important things. I think endometriosis is simply another form of inflammation in the pelvis caused by probably gut flora, inflammation, bacteria, and a high carbohydrate fiber diet. And I usually tell, got to really, really reduce the carbs, get rid of the fiber. If you're going to have vegetables, then you want to really simplify them and add cream and butter and make a beautiful soup and spread out when you have your meals 12 to 24 hours apart. It seems that the more we can reduce the amount of food in our gut and reduce the input of the glucose to the bloodstream, which is causing that thing called glycation. Look up glycation. Glycation is likely the cause of diabetes, hypertension, cancer, stroke, infertility. And that's why I think it's so important. And why people who appear to eat exactly and do exactly like you have 5 or more babies, I don't know. But when it isn't working, this is one of those really interesting and amazing ideas that we've seen. So, and don't forget, acupuncture, massage, meditation, light therapy. There's a lot of evidence that light therapy can be very helpful. And I've been working with Jennifer Waters. She's in our Syracuse location in the Healing Arts right next door at 191. And she's really done some great things. But so has Donald Clark's been with us for a long time, really has a lot of experience. And Chi, but again, so many others that I apologize, I'm not mentioning everyone, but they're all really, really valuable. And Stan and Melanie, thank you very much for being with us. Colleen, been trying to conceive for a long time. And, you know, we're, again, praying that natural and or one way we're going to help make this happen. And that's really the thing. And so, you know, the more we all help in the resources, and I've been working on the idea how either a GoFundMe account or something where we can all contribute to this family group to help with meds and treatments and other things. You know, just some ideas on helping others in this whole part. Hi, Kelly. How you doing? Thank you very, very much. Sheena, supporting a friend of hers. Awesome. And, You know, friends and family, listen. This is my new one. Listen, love, and learn. You know, it's not this, it's actually this. And the more we can just love, listen, learn. And by listening and sharing and touching and holding, and it is really important to do for all of us. And I think questions, but answers are short and far behind. How can one make it easier to help the fertility in the body? Well, slow it down, number one, okay? And imagine fertility is really critical and important. And share a successful story with someone and all the trials and tribulations and the bumps. You know, like a rhythm of the heart rate, it's not a flat line. And so these ups and downs and bumps and ripples are all meant to be. But it really is what you put in here, and how you take care of the Ferrari is going to be the really important part to this. But slow it down is really important. And look at keto, paleo, and I mentioned paleo because it's hard to do the keto for so many of us. And I have a very, very, very sort of much stricter keto. I call it the baby diet, bacon, eggs, butter, beef, like a lion. The symbol of strength in the world is a lion, not a pig or a cow. But as a vegan or vegetarian, there are ways to do this. And that's where eggs and cream and butter and cheese for the vegetarian and for the vegan, it really is separate out those carbs and simplify them as much as you can, eating 12 to 24 hours apart. I call it intermittent feasting. Fasting really helps, but I don't call it intermittent fasting because you're not intermittently not eating. You're really intermittently only choosing to eat once or twice a day. The body burns fat, and that's the fittest fuel for every single cell. It doesn't burn sugar or protein. It converts all sugar and protein in the liver to fat, stores it, and fat doesn't cause any diseases. It actually is survival. So if you're overweight, you may be fitter than you know, but by cutting the carbs, you're going to allow the physiology and the metabolism of the energy that flows through your body and all the fermentation that's going on in the gut to get out of there. And then health and wellness actually comes. I've seen so many people off diabetic meds, off hypertensive meds, off high cholesterol meds, colitis, irritable bowel, all goes away. And I've been so amazed in all of this. And I've seen AMHs go up, FSHs go down. I've seen so many people just have a keto baby, paleo baby. It's pretty amazing. So IVF cycle again is about 10 days of stim, 2 days to retrieval, 3 to 6 days to transfer, and then 2 weeks after the retrieval is a pregnancy test. If you do a freeze-all, you're going to wait about 6 to 8 weeks before that transfer is happening. And check out our website, cnyfertility.com, also CNY Healing Arts. And I've got Mind, Body, Smile that I put a lot into it over the years. I'm kind of up and down on it, but it really still is important to me how our mind and how we take care of both of these things, right, will affect how we feel and how we can be more happy in life, even with all these real challenges. And believe me, we all have them. I always say dead people have no problems. And Aaron, how you doing? A pleasure. Crystal, we look forward to seeing everyone. Penny, do I recommend 30, 60, 90-day prime for low AMHs? You know, after going to Dr. Gleischer's seminar and meeting with people from around the world, a longer prime, because the egg and the sperm take 90 days plus in order to mature, and it may be what it takes to reduce inflammation in our bodies, improve blood flow. And so I think it's real important. Human growth hormone prime, even for guys with bad sperm, may be helpful. But that keto paleo is a slam dunk for all of us. Royal jelly for egg quality. You know, I'm not a big fan of it. I think there are some herbal medicines that can help with this. Acupuncture probably more than anything. But in general, DHEA, low-dose naltrexone, the Ovasitol, Ovavite, and Keto is king. And talk nicely to your ovaries and your testicles and sperm and egg and all of this. And remember, more frequent sex if you're in a hetero relationship, then it really can be very helpful. And if you're not, even relationships with your partner can be very, very important to do. And so we've been talking a little bit about orgasms and sperm, ejaculate in the vagina before retrieval, before transfer. All these things can be very helpful, by the way. We're finding more and more so. Zero money for IVF, and that's one of the biggest challenges. Something for nothing. And you're right, it's hard, but it is actually more affordable than anyone ever imagines, and you just have to believe and have faith. And read The Secret by Rhonda Byrne. It can be really, really helpful, but don't give up. We have payment plans that can be very helpful, but phone a friend and keep at it and don't give up. And hey, Terry, how you doing? And Amber, a pleasure. And we really, really are so grateful to everyone. Eating my bacon, Katie. And it's interesting because beef bacon, if you can't eat pork, really amazing. And there's no such thing as turkey bacon and turkey burger. It's not a fatty meat. It's man-made. I say stay away from it. And Francis, can we explain can you explain what you are seeing with egg retrieval when doing back-to-back stem cycles? Does a back-to-back stem cycle work? So a couple ways to do that. So typically you do a stimulation at the beginning of a menstrual cycle, a retrieval, and then you wait for the menstrual cycle to happen again before we historically did an egg retrieval. And that's a back-to-back. The other way to do it is you do a retrieval, and then before the next period, 3 to 5 days, you start the stim right away. You don't have to be in the midst of just starting your period. And we're seeing in many cases better number of eggs, better quality. And so depending on your time frame, it seems to be something that people who have to go to chemotherapy or other treatment or have a short amount of window, they want to do serial egg retrievals and either egg banking or embryo banking. And also in some cases, the back-to-back improves the quality and the quantity. So we are seeing some improvement in that. And again, my sense is blood flow, and it's kind of like working out. Now, I'm not a big proponent of working out, by the way, but slow it down. But anything you do on a regular basis is going to build the neuro memory. So rather than muscle memory, it's the neurons that are remembering and setting in new neural connections, and the blood flow is improving. So neovascularization is really happening, I think, in so many ways in the ovaries. And we pray every day to all of this. Trying hard, yes, and in this whole process. And it's interesting about prayer, all right? So as we all pray together in sending our thoughts and energy out there, kind of like this energy that we're zooming through the airwaves, we don't see the energy, right? We don't understand it. I don't have any idea how any of this stuff works. None of us really do, but it does. And Edison said he doesn't know how electricity works, but it works, and so he used it. And really the idea here is that prayer, meditation, visualization, vision boarding, put the pictures on your wall, on your mirror, on your phone, wherever you're at, of what you desire. And the universe will bring all the energy together to help make it happen. So you gotta really keep at it and positive as best you can, even when you're feeling down and depressed. Take a moment, write your feelings, and then come to the next level in this. Lori, how you doing? And so, it's learning for a friend or a family member and then sharing with them some ideas that maybe they haven't thought about. And I really sort of push the keto and the food and the stress, and I'm trying to crack that really hard egg for all of us, for finally that little bit of egg, the light to shine in, and for us to kind of see a new path and a new way in this whole process. Jenny, how you doing? Vitamins to help the body be more fertile. Well, low vitamin D, so boosting vitamin D, really important. I've been recommending the CoQ10, folic acid, the omega-3 fatty acids are real important. Multivitamins, really get your ADEKs. Make sure if you have a low hemoglobin, low iron, you want to build that up. Really important in all of this. So making sure you're having that checked. When we talk about supplements, always think about thyroid, and there's a lot of thyroid dysfunction out there. I believe the thyroid gland is one of the first to go, and it's one of the signs of immunologic dysfunction or autoimmune diseases. And so I believe most of this is due to excessive plant antigens, hyperglycemia, and anything you can do to change that. But we really need to be looking at thyroid function testing, look at thyroid antibodies, anti-nuclear antibodies, lupus anticoagulant, look at thrombophilias, and look at all these things. And in some cases, look at some vitamin levels can be very helpful in that. But the Ovasitol and the Ovavite, and extra vitamin D if needed, and the Theramegas, which is the omega-3s. And so Theralogics has the Ovavite, the Ovasitol, and the Theramegas. And then the DHEA is that other supplement for those with a low AMH or diminished ovarian reserve. And so by adding the DHEA, 25 milligrams 3 times a day or 75 milligrams a day can be very, very, very helpful in the process. Talk to your herbalist. They can be very helpful, but you got to be careful. There's a lot of things in herbs that we don't know what they are, but talk to someone that has some real experience when it comes to fertility, acupuncture, and traditional Chinese medicine. Want to do embryo adoption? Is this possible? We do offer donor embryos. One of the challenges, a long list of people interested in donor embryos. We're really asking all of those out there that have embryos that are sitting to help build a family. Of all the things that you can do in life, giving a kidney, part of a liver, donating blood or bone marrow, more and more we're donating parts of our body, but life. Donate eggs, donate sperm, donate embryos. And so really our job, all of this is in this community, is to ask for help. It's phone a friend. And so keep going out there on that. But we do embryo donation. If you have embryos anywhere out there that people want to ship to CMI fertility locations in Albany or Syracuse, we also help handle that, and we believe we can do transfers at a lower cost, but still, I believe, high quality. And remember, we turn no one away. And we don't have criteria that will allow you to do this or allow you to do that. And if you're a poor responder, we're still here to help, because we believe that there's still ideas that maybe people aren't open to or sharing in this. Janine, how you doing? Before egg transfer, what kind of genetic testing can be done to make sure we're transferring good eggs during an IVF cycle or good embryos? Well, it's probably worth the karyotype for the man and the woman, male and female, the sperm genetics and the egg genetics, to look for translocation or other gross chromosomal abnormalities. Genetic screening with a LabCorp has a large genetic screening along with Good Start and others that look for single gene disorders that many people may contain. It's maybe worthwhile. And then PGD testing, pre-implantation genetic screening, I think is really best. Can be done to look for chromosomal abnormalities, but interesting enough, we're finding more and more that it's not as accurate as we thought it was. I think if you have a lot of embryos, the testing is probably more valuable to really pinpoint those few, quote, normal embryos. But since the test isn't 100% accurate, it's not 100% delivery rate. And we're finding for some people, even with abnormal embryos, they transfer them and get normal babies. But these are the things that we discuss and offer. You know, the recommending, I don't recommend things. I give options for you, and you're in charge. You make the decision, and that's where we're coming from. And, you know, people learning so much about the human experience, the human body, and the fertility journey, and they already know which way they'd like to go. And so we're all willing here to help on that journey, but add some other ideas that you may or may not have heard about. Are all IVF pregnancies considered high risk? Well, I think all infertility pregnancies, so whether you're not conceiving and then you conceive and deliver a baby, or your repetitive miscarriage, any pregnancy conceived after a history of infertility should be considered high risk and monitored closely. That doesn't mean you have to see a maternal fetal medicine specialist, but talk to your OBGYN. Many of them take care of a lot of high-risk pregnancies and can take care of these without issues. Thank you, Katie and Sarah. When do you recommend, Sarah's question, when do you recommend fresh versus frozen? Well, if you failed on fresh, consider frozen. Failed on frozen, consider fresh. Depends on the quality and the quantity of your embryos. But I've seen so many people who make poor blasts, do a day 3, freeze all day 3. If your progesterone level on the day of trigger is elevated greater than 1.5 to 2, then consider a freeze-all. Or if you're hyperstimulated, consider a freeze-all. We really recommend that. We've been talking a lot about the endometrial receptivity assay, which unfortunately in New York State we can't do, but everyone else in America can. It can be helpful. It's another diagnostic test to try to pinpoint the timing of transferring that embryo. You need to be on the medicated cycle, which is basically estrogen, oral, patch, shot, or vaginal for 10 to 14 days, followed by 6 days of progesterone IM or vaginal before the endometrial biopsy, which also could be a scratch, by the way. And then the test will look at the timing between the start of progesterone and the most optimal window, which has some errors in this, and it's not perfect and it doesn't help everyone, but it's something that we can help with that through clinics outside of New York. And we're hoping by you sharing, please, Department of Health in New York State, allow this, it'll help us all in this process. Megan, how you doing? Thank you for your shout out, by the way, and we're all together doing it. That's one of the most important things. And, you know, I didn't become a physician to simply make a living. I really did this in order to help people. And I believe we continue to focus on that and do that. And my team is great. We're not perfect. You know, this is an emotional process. So anything you can do to share, hey, how can we be better? And we can slow down, and we can sometimes say, you know what, I apologize. Let me listen and hear better, and let me understand that a little bit better. Caffeine. And Rachel, thanks for the question. Does caffeine affect fertility? Working towards my first IUI while waiting to be able to afford IVF. And I'm trying to figure out if the stress of no coffee is worse than the caffeine itself. Well, I was on vacation last week. I got a little bit of a virus. I couldn't drink coffee for 3 days. I was out of it. And I've been off coffee for about 7+ days now. And it's a little challenging. I don't think caffeine is an adverse effect on fertility if it's mild to moderate levels. If you're drinking like me, it might. I slowed it down a little bit, a little herbal tea for now, and less coffee. I don't think it's the major factor at all. I think that de-stresses, it may help blood flow, and by de-stressing and it's gonna open up blood flow and reduce that inflammation in areas that you and I don't want it. So that's not one thing I would tell people they should work on stopping. If you're drinking coffee, remember cream or butter. That'll help a lot too. Thanks, Tina Marie. Really appreciate it. And Tam, how you doing? And everyone, really, really, really a pleasure. And you know, our website and our older posts on Facebook are really, really helpful, I think. You know, it's kind of becomes very repetitive about what we're talking about. But, you know, there aren't that many new things coming out in this process. One of the things I've really been talking about, more natural cycles, low-dose stims, freeze-all cycles. You know, you'll hear me more and more and more and more, keto, keto, keto. And the Fertile Keto Cure is it. And I'm amazed at 61, almost 62. I'm beginning to say 62 in March. But we're really younger than we imagine. It's right here in our brains. And the more you focus on how young and vibrant and healthy, remember, no matter what your size, no matter what your condition, you are a Ferrari, and we can shift it up and change it up by a little oil change and a steam cleaning and changing the fuel and slowing it down. Really, really helpful. Let's see, Jasmine, what makes someone a better candidate for a mini IVF? Well, the mini IVF is less likely to get you frozen embryos, and we're more likely to do a fresh transfer, by the way. And younger, and even on the younger and the older side, you know, the 20s and the late 30s, 40s may be reasonable to not overcook the eggs. And my sense is we're going to do more and more minis, which is a combination of letrozole clomid plus gonadotropins of 150, going left follistim or menopur, and with or without a little bit of LH or low-dose HCG. And, you know, a lot of it comes down to a personal preference. I want less meds, less overstimulation. I mean, we have had some patients hospitalized over hyperstimulation, surgeries, and even rarely have lost an ovary because of hyperstimulation. So these medications aren't without risk to this. I think they're low enough, but the bloating and the fluid can be really hard. If IVF, you know, my sense is if we can think about 4 retrievals and at least 8 transfers, more and more people would have babies, but the emotional and the financial and the physical trauma or all this is really challenging. So I think that's one of the reasons we've stuck to the stimulated protocol. But we don't really have like a straightforward, this is who should do the mini, this is who should do the standard, and this is who should do the high dose. But I think it's a conversation to have and look at the option. And one of the things about the mini or the low dose is that you're going to make fewer eggs and you got fewer embryos, and so you're likely going to get 1 or 2. Although I keep on telling the story about the natural cycle: 4 eggs, 4 embryos, 2 transferred, 1 baby, and 2 on ice. So it's something to keep in mind in all of this, and grateful to everyone, and you know, just all of the shout outs that everyone's doing here is really, really so helpful and really appreciative to everyone. And okay, Monique, underactive thyroid have an effect on IVF, and we're going to finish up in just a couple minutes. And thanks everyone for hanging out so long with us. But overactive and underactive thyroid. Thyroid gland is one of the most common disorders with hypothyroidism and with thyroid antibodies and idiopathic hypo and hyperthyroidism. It's really, really, really grown out there. And I think, again, it's back to stress and food, standard American diet, SAD, fruits, fiber, and vegetables in excess amounts. Slow it down. But the thyroid abnormalities will affect implantation. We like to see the TSH less than 2.5, and more I'm pushing to 1 to 2. Interesting enough, you put people on estrogen and these drugs, and suddenly it goes way out of whack, and so you have to follow it weekly. You have to treat it, and quite often we don't even know why it moves so fast. But I want to thank everyone out there and for all their shared responses, and we'll be sharing the winner of the IVF giveaway, but realizing that it's persistence and a positive approach in changing it up, and we're all working as a global village in all of this. And so I'm really, really, really grateful. And listen, 315-416-9872. That's my cell. I get a lot of text messages. I share with the team. I don't always get back to you right away. Remember, through our web portal, eIVF and correspondence can help, but our global team is amazing, and they're always here to take calls. So I think we're going to end it up. We're going to be doing this again in about 2 weeks. Anything we can all do to improve, please let us know. And God bless. Dr. Rob Kiltz, My Fertility, really, really a pleasure.